welcome to the Viana Show. Today we have a special guest with us. Welcome, Lorraine.
Thank you for having me.
Lorraine is with us today to talk about her experience with breast cancer. She is a breast cancer survivor. I have a few questions for you.
Okay.
How did you know you had breast cancer?
I had found a lump in my breast, and then I followed it up by going to my doctor.
How did you know? Oh wait, no, I just read that one. Does breast cancer run in your family?
I do have some family members that have had breast cancer, yes.
What tests did you have to take?
You go for a biopsy first, and that determines, they take the cells and then they do exams to determine if you have the cancer cell or not. So that was the initial test by having the biopsy done with a big needle. They put it into the breast itself. They take the tissues out, they examine it, and then they find out if you have cancer or
not. What type of treatment did you have?
I had chemo and then followed up by radiation and also surgery. I did have a double mastectomy, which means I had both of my breasts removed.
What type of cancer stage did you have, or are you at?
Stage 4. No longer that, but in the beginning was diagnosed with stage 4.
What happened with treatments?
As far as what? How I felt, or
yeah.
You mean as I was going through chemo?
Mm-hmm. Did it hurt or whatever?
The chemo itself doesn't hurt. What they do is when you get chemo, they put a device called a port inside of you. It's a round little disc, and they put it underneath your skin. It's just like a 2-inch mark. This is at the beginning, and they put it underneath your skin, and because you have so many needles that you have to get, instead of putting it in your arms, eventually your arms would like collapse and your veins wouldn't work. They put this device in, and this device, they attach it to like your veins on the inside, and then they put the needle in the port, and then the medicine goes through your body that way. So that didn't really hurt because you didn't feel it. I mean, you feel an initial pinch, just like when you go to get a shot, but then you're hooked up to IVs and the bags on the side, so you don't feel anything as it's going in you. After the fact, it could take a couple days. You do have symptoms. Your teeth really, really hurt. Your gums really hurt. You get a lot of sores, you know, like when you have a canker sore. You get a lot of sores in your mouth. Different cancers are different. Breast cancer patients and women, sometimes I got a lot of bone pain, like a lot of hip pain, a lot of bone pain. Luckily enough, there's a lot of medicines now that prevent you from getting sick, like vomiting. So I was taking a lot of medication. So luckily enough, I did not get sick a lot, like vomiting. I just took a lot of medicine. But you don't eat a lot because you don't feel good in the very beginning. And that's really it. It's different. Everybody has different symptoms, but those are the basic symptoms when you have chemo most of the time.
How long were you in? How long did you have cancer?
Well, I'm still going through it now, but as far as what you, I guess, can categorize it now, I was diagnosed 4 years ago, but now I'm 3 years out of my treatment. So sometimes they call it remission. Mine's not quite in remission yet because I'm still having some surgeries done, but I'm basically on the 80% better of the scale, instead of being on the lower end of the scale.
How long are you? No, I just said that. How do you feel now? Like better?
Oh yeah, 100% better. You live with stuff just like anybody. Like your arm may hurt you every once in a while from when you broke your arm. So because of the surgeries, I have aches and pains, but you just get up and you deal with what you have to do. But definitely better than I did. I mean, I'm happy to be here and, you know, to be alive. I'm talking to you and you and your family, so very lucky in that case.
How long did this change you? I mean, how did this change you?
Oh boy. It's a tough one. Sometimes people ask that.
This is my favorite question.
Yeah, and this is probably the hardest one to answer. I think one thing I could probably say is it made me more aware of my body and things that are going on. You know, like, but the one thing I don't do, see, and this is why it's a hard question, I don't think about it every day. I can't. There are some people that do, but you would drive yourself crazy.
Yeah.
So I pretend, if that's even a right word, to like, I don't have it. Until like if I have a bad day or something hurts. But I try not to, honestly, I try not to think about it. I try not to think that that's what I'm dealing with, so that I can get through my day and not feel sorry for myself either. So, but the one strong thing it did change, which now I don't take advantage of, is I make sure that if something's hurting me, I go to the doctor or I call and say, okay, I'm not going to play around with this, get it taken care of. So I guess that's really it.
What do you do now to raise awareness? I see you went for a breast cancer Avon walk.
Yes, I eventually volunteer at the hospital too. There's restrictions though sometimes when you are still going through treatments. I don't know why that there is guidelines, but some of the volunteer groups at the hospital or some organizations, they want you totally be clear, like for, I don't know, years and years before you can help volunteer, which makes no sense because I can help somebody that's going through it right now, and I'm going through it right now, and I have more of a relation with them and they can understand. Yeah. So that's unfortunate. But yes, I just did do a wonderful breast cancer walk, and there was about 4,500 people that showed up.
Oh, wow.
So it was really, really a great turnout, a great organization, and I was happy to do that. But I'll speak to anybody if somebody has any questions, if a friend needs anything, and they know somebody, they call me, so I will help anybody with anything.
Well, thank you for sharing your experiences with us. You are an inspiration. Thank you for coming, and thanks.
Thank you very much. I appreciate it.